Appreciate you, sir. All right, I think I have the right screen share. Did my slide just change?
Yes.
Yes.
Okay, awesome. Okay, great news in Colorado, as well as rest of the nation. We're seeing a consistent decline in overall cases. If you think about it, it makes sense. We all know that cold and flu season is much more robust in the middle of the winter, and that when spring arrives, that our cases of influenza and the common cold decrease. And so obviously, COVID virus is just coronavirus. It's a cold virus as well, and so we would expect there to be some seasonality. So it's good where we are. Keeping in mind though that this rate is still so much higher though what we saw in August and then what we saw in the initial surge. So it's good news that we're not here anymore, but we're still not back to the levels that we enjoyed over the summer. So just keep in mind that we're headed in the right direction, but we're still obviously not quite there yet. Our overall incident rate here in Colorado is significantly decreased as well. And so there is some artifactual decrease because the number of total tests have decreased as well. But this is decreasing, the slope of the line is reproducible. And so that's still good news for us, that the number of tests that are being done, less of them are positive. Overall incident, our state continues to be less dark brown, which is perfect. Lake County unfortunately had a bit of a blip with a social event that happened last week, but still most of our neighbors are, at least half of the counties in Colorado are showing a decrease in incidence. Overall hospitalizations continues to decline as well. We're still not back to where we were, over the fall here, but we're certainly headed definitely in the right direction. And of course we're not here, which was terrifying. The overall death rate mirrors the cases, and so if less people are getting infected, less people are dying, which is always a good thing. Our local data, we are not mirroring our neighbors in other counties. We did have an enormous super spreader event here. We had 20 cases in one day here in Lake County, and then of course only to be matched by 15 cases for a couple days here later in that week. And so the super spreader event happened at the end of January, and then obviously this is the repercussion. The good news is that we're coming back down, and so all of those people were effectively quarantined. They did the right thing, stayed home, didn't spread it to other folks, and so we're not seeing a significant exponential spread. We still have positive cases every day, which is similar to what we were seeing here in the Christmas time. But the super spreader event could have been disastrous. But fortunately, the people who were involved did the right thing, quarantined themselves, and did not infect many others. Our overall incidence here, we had that peak, of course, when we had our super spreader event, but then came down again, which is awesome. And then our slope of our curve still pretty darn steep again, just because of what happened with our super spreader event. But hopefully we'll see a flattening of the curve here over the next several weeks as our incident rate decreases. Hospitalizations, these all came from the super spreader event, and so we were able to take care of most of the folks who needed hospitalization based upon their exposure that they had, and they were epilinked to the people that during that event. So it really does happen. It's certainly not a mystery. Our overall incidence and positivity, 16.2%. So very, similar to what we saw in our enormous surge that happened over the Christmas holiday. The rest of Colorado continues to decrease 3.69% here. So hopefully our numbers will continue to go down. If you look at our total numbers, and remember, these are just numbers of people that have been tested here in Lake County, 544. There are about 100 more that have been tested outside of Lake County but still live here. And so our total positivity rate, our total positive rate of people is well over 600 at this point. If you look at our incident since data collection, 10.7%, there are some duplicates there. Some people have been, have more than one test, but that number continues to increase, and that's our herd immunity level. Still very, very far away from that 70% that we need to get before we can, all take a big breath with maybe without a mask on. Vaccinations are going very well. We have 100% of our 75 plus group who wanted to be vaccinated, 2 doses in, 100% of all of our healthcare workers and first responders, 2 doses in. And then we have almost finished the first round for the 65 plus group. That will be completed by today, which is great. And so those folks who—
Just trying to get the boiler fired up.
I just heard somebody walking downstairs. I was like, is that a ghost?
Hey, Greg, you need to.
Oh, okay, wait for it just a second.
He's muted.
All right, awesome. We're almost done, as I was saying. About a week from today, we should have 100% of all the 65 plus group that wanted vaccinations with their first shot in their arm. So certainly, if you are 65 years or older and have not yet had a vaccination and you would like one, please make sure to call either St. Vincent Health or Rocky Mountain Family Practice, and I'll put that number in the chat here in a second to get your vaccination scheduled.
All right. We like the good news, Dr. Lisa. So thank you.
Absolutely. Does anybody have any questions for me?
Dr. Lisa, this is Pat Klober, and I appreciated the fact that I did get my second shot and I didn't get many side effects at all. Just curious, was this a super spreader event, a public event or a private?
I don't know how to answer that without giving away who it was. Of course, I'd like to be respectful to those folks. But it was a group.
Absolutely.
Yeah, it was a group of a little over 100 folks who got together in the same place inside, and most of them became infected. It was actually impressive to watch how contagious this virus is. And of course, we didn't do viral isolation, and so we don't know if this is the European variant that was, touted to be more contagious. But whatever it was darn contagious. And folks, who were standing next to one another without a mask certainly became infected. So yeah, it wasn't good. Lessons learned, but again, it was the public health department, pounced into action and really did an excellent job containing that outbreak. So we did, yeah, it could have been so much worse, but it wasn't.
Thank you.
Yes, ma'am.
All right. Any other questions for Dr. Lisa? Okay, well, thank you once again for the update.